Okay, I'm going to show you today how to take care of a drain tube after a surgical procedure. So this patient had a laceration that was repaired and a drain tube was placed to allow any fluid to flow out and not accumulate under the skin. The first thing that we ask owners to do at home is to keep the drain tube openings clean. So you can moisten some gauze, some cotton balls, or even some paper towels with some of the chlorhexidine solution that we provided you, and then just gently cleanse the opening both under and over the drain tube. The reason why we ask you to do this is because as the tube drains, some of the product that comes out of it will cause the drain tube opening to gum up or plug up. And we want to make sure that that doesn't happen so the drain is allowed to function properly. So again, just cleaning both areas up and over. After you've cleaned the area, we do ask that you flush the drain tube. So you'll do that using the curved tip syringe that we've sent home with you, as well as more of the Chlorohex solution. You'll place the edge of the curved tip into the drain hole and you'll flush and ensure that it's flushing out the other side. And you'll do it also down here as well. This again just kind of helps make sure that we purge any fluid that might be under the skin out through the drain tube opening. After you've flushed, you'll then apply your ointment. We commonly send you home with something called Tomorrow ointment. It's an antibiotic ointment that we want you to infuse into the drain. You'll open up the cannula, push the cannula into the drain holes again, just give it a gentle squeeze. You'll ensure that it seems to be coming out the other side, and then same up and over. Doesn't take a lot, just a small squeeze, and that's going to allow all of that to get in underneath that drain. You'll want to make sure that you clean this before you put the cap back over by just using one of your gauzes to clean that tip off and reapply it. And then last but not least, after you've kind of made sure that everything is nice and clean, your edges aren't oozing as much, you'll apply either some vitamin A and D ointment or like Neosporin to both ends of the drain. Again, just to keep that area kind of moist and from gumming up or scabbing over, which will plug the drain. And that is taking care of a drain tube.